Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. Now we are going to see one important medico-legal chapter, that is medico-legal aspect of injuries. Medico-legal aspects of injury. So here what we basically deal with is like what are the legal aspects and medical aspects that involves the injury. So injury means wound, any bodily injury that you can get. What is the medical implication? What is the legal implication? And whenever you come across such cases, what you are supposed to do? So basically you will be getting a lot of assault cases, right? You will be getting some assaults, something will be accidental. So you will be dealing with lot of injuries. So you will be giving wound certificate for that. So how to write that wound certificate? What is the significance of this wound certificate? What is a simple wound? What is a grievous wound? Like that we have to know. So all these will be dealt in this chapter. So first we are starting with the extreme end of the legal aspect, that is torture. So what is torture? So torture is a wanton infliction of pain. Wanton infliction of pain. This may be done to get some information or make them to do something or simply to give them pain. It can be for any reason, but you are purposefully, you are intentionally giving some pain to them by hitting them or doing some sort of mentally, physically, you are giving some kind of torture to them. So this is the definition of torture. And what are the types of torture that is usually seen? So first is this. This is known as Spanish donkey or forced straddling. So this area, this will be sharp and people will be made to sit over that with weight over their foot. So they will be pushed down and the sharp area, it will go injure their perineum. So this kind of torture is known as Spanish donkey or forced straddling. Next, what is this? This is electrical torture. This is electrical torture, also known as picana or cattle prod. Here what they will do is, they will try to electrocute you. So this device, it can cause electrocution. So they will try to electrocute you, thereby inflicting pain and trying to get whatever they want. So this is electrical torture, also known as picana or cattle prod. Next is this. This is known as tiger bench. So here what will happen is that they will make you sit like this in a L shaped and they will tie you all over, everywhere they will tie, and gradually they will increase the height of your feet, So by putting something under, they will keep on increasing the height. So eventually it will come like this. So you will have pain over here, everywhere. You will essentially feel pain over the knee. So they will keep on doing this, and this technique is known as tiger bench. They will tie everywhere. And they will increase the height of your feet. This is tiger bench. Now this one, where they hit in the foot. They hit the foot repeatedly. This is falanga or foot whipping. And why they used to hit the foot is that they will be doing over the soles, because there it will be really hard to see any bruises. You will not be able to find any bruises over there because the skin is very thick and there is not enough subcutaneous loose layer for the blood to accumulate and get swollen and visible outside. So this is why they prefer these palms and soles. So this repeated hitting on the foot is known as falanga or foot whipping. And this one, this is known as parrot's perch. So they will tie you from a stick, like horizontal stick, they will tie your legs and arms like this, and they will just make you hang from the ceiling. So this is parrot's perch, and this is very famous. This is submarino. They will try to suffocate you. There will be suffocation, and when it is done by using these dry objects, this is dry submarino. And if they put you underwater, they will put you underwater and they will suffocate you, it is wet submarino. So this is submarino, also known as waterboarding. So this, they will try to suffocate you. If it is done with water, this is wet submarino. If it is done without water, then it is dry submarino. Then there is another Burmese torture techniques known as iron rod. What they will do is, like tiger's bench, they will tie all over, they will tie, and they will use this iron rod, and at both ends, at the both end, they will put some pressure. They will pull these iron rod down. They will hang some weight towards it, or they will pull it themselves, or they will stand over the rod. Because of that, you will feel extreme pain over the knee. Like that, they will keep on going all over the body. They will roll the iron rod and they will keep on putting weight on the edges of the iron rod. So this is one Burmese torture technique. So all these techniques are used for torture. And according to Declaration of Geneva, doctors not to use medical knowledge to violate human rights. So not just these physical methods, doctors with our medical knowledge, we can give a lot of drugs which can lead to pain. So we are not supposed to use this. That is the Declaration of Geneva. That is the medico-legal aspect of this torture. And apart from that, what is the duty of doctor in torture cases is that we have to do post-mortem examination. All the torture death, especially custodial torture, we have to do post-mortem examination, and there custodial torture, the inquest will be done by the magistrate. So you will have magistrate inquest, and this autopsy should be done by a board of autopsy surgeon. Like there should be not one people, there should be 2 to 3 people. There should be a board of doctors. Only board of surgeon can do, and it should be completely videographed. Videography of post-mortem examination should be done. It is very mandatory. You have to video record it, and you have one prescribed format by National Human Rights Commission. You can follow that format and should follow only that format. According to that format only, you have to give the report. Why is that? Like apart from the natural death, there are certain things that you have to look in torture death. So if it is a torture death, there will be certainly some sort of injury in the body. And normally you won't be able to find injury externally. You have to do certain dissections to find out those injuries. So first you will be making an X-shaped incision over the back. This X-shaped incision over back to find out any bruises over the back muscles. So they will be usually hit on the back, palms or soles, or sometimes over the calf. So these are the areas you have: back, soles, calf and palms. These are the area where the injuries will be usually hidden. You have to make sure that you have put incision over all these muscles and you have dissected them properly to find out any hidden bruises. So the main motive in doing these post-mortem examination for these torture cases is that you have to find out whether they have done any inhuman treatment, whether they have given any pain infliction, whether they have done any of these torture techniques like electrocution or submarino or burning or any sexual abuse. All those things you have to find out, and in the prescribed format you have to do the autopsy, videograph it and send it to the National Human Rights Commission, and they will analyze the report and they will make sure that does not happen in the future. So this is about torture. Next, coming to the wounds. So we have grievous hurt and simple hurt. So what is grievous hurt means? It has some severe punishment according to our constitution. So grievous hurt, they are dangerous and severe in nature, and we have divided what are the grievous hurt. So according to our constitution, we have some 8 clauses of grievous hurt. When this comes, when you see this injury in the wound certificate, you will write that this is a grievous hurt. And if you say it is a grievous hurt, the punishment is different. The simple hurt and grievous hurt, the punishment is entirely different, and grievous hurt are very, very severe and dangerous in nature. So what are those grievous hurts? We will see. And this 8 points, it is very, very important. It is must know for each and everyone. You should be able to recite it word by word without missing even a word. You should be able to recite it. So first is emasculation. Second is permanent privation, not a temporary, permanent privation of sight of either eye. Like there can be some corneal abrasion, okay. It may be a very small injury, but if it happens over the cornea, because of the corneal abrasion, you can get corneal scar formation, and that scar, it can impede your vision. And if it is a very big scar, you can completely lose the vision. Even though surgery can correct it, but still there was loss of vision, right? So it is considered a grievous hurt. So even though surgery can correct everything, still there was loss of vision. So we will consider that as a grievous hurt, not a simple hurt. So it has to be a permanent privation of sight of either eye. If that abrasion healed without scar, then it is not a grievous hurt. If that abrasion heals with a very big scar, impeding the vision, then you have to consider it as a grievous hurt. So you have permanent privation of sight of either eye. You have permanent privation of hearing of either ear. Like somebody could slap very hardly and their tympanic membrane could rupture and they could lose hearing. So that is also considered as a grievous hurt. Even though externally nothing is seen, only tympanic membrane is gone, even then it is considered as a grievous hurt. Then privation, just consider there is no permanent word here. Privation of any member or joint. What we consider as member or joint is anything that is able to function independently. Like you have your liver, you have your internal organs, all are considered as the member, and joint, all your fingers, bones, everything is considered under this clause. Any injury to that, it is considered as a grievous hurt. So if someone is giving a stab and they are injuring their liver, even though you can recover from that liver injury, but still you are getting hurt, right? So that is considered as a grievous hurt. Next, what you have is destruction or permanent impairing of power of any member or joint. Like your member or joint here, it will be mostly your fingers, toes, something like that. If someone is cutting off the finger, there is permanent privation and destruction, right? That is considered grievous hurt. Even the tip of finger, if it is gone, that is also considered as a grievous hurt. Then permanent disfiguration of head and face. Any injury over the head or the face, if it is permanent, if it is leaving a scar, then it is considered a grievous hurt. It may be a very, very small injury, but still if it is leaving a scar over the face, it is considered grievous hurt. Even though it can be corrected by plastic surgery, but you are getting a scar of that, right? So it is considered a grievous hurt. Then fracture or dislocation of bone or tooth. This is very, very important. Like even a simple fracture, like a part of the bone, if it comes off, or it don't even comes off, it just simply dislocated. So even under that circumstances, we will consider that as a grievous hurt. And joint also, like you have your shoulder joint, it can be easily dislocated and it can also be put back easily. You don't have to do much. By a simple maneuver, by OP treatment, you can correct this shoulder dislocation. But still there was some dislocation, right? So it will be considered as a grievous hurt. So these are the important classes of grievous hurt, and the final 8th clause. This has 3 parts. The first thing is a hurt which endangers life. It may not cover under these 7 clauses, like someone is burning you. They are pouring kerosene over you and they are trying to kill you. You may escape from that. You may get hurt, but not life, like you will not lose the life, but still it is life threatening, right? It is still endangering your life. So those kind of burns or acid attack like vitriolage, all those things will be covered under this clause. So which endangers life or causes the sufferer to be during the space of 20 days. This 20 days is important. This 20 days they will make you in pain, like you will be having pain for 20 days and you will be unable to follow ordinary pursuit. Like you will not be able to brush yourself, you will not be able to take bath or use the toilet. So those kind of daily ordinary pursuit, if you are not able to do it on your own, then it is also considered a grievous hurt. So all the 8 points, it is very important. You have emasculation, permanent privation of sight of either eye, permanent privation of hearing of either ear, privation of any member or joint, privation, you have the permanent privation of power of any member or joint, permanent disfiguration of head and face, fracture or dislocation of bone and tooth, and any hurt that endangers life or causes the sufferer to be hospitalized for 20 days or unable to follow his ordinary pursuits. So these are considered as grievous hurt, and in the wound certificate, if you come across any of this hurt, you have to mention it as a grievous hurt. Otherwise, you can give a simple hurt. So this grievous hurt is had much important punishment and much more fine than the simple hurt. So these are the medico-legal aspects of injuries. With this, we are concluding this video. Thank you for watching.